Greetings family, welcome back to the channel. If you're new here, make sure to hit that subscribe button, like, and share this video with as many people as you can, because today's story is one of the most powerful, emotional, and thought-provoking journeys you'll hear this year. We are diving deep into the shocking realities uncovered by the investigative program Cutting Edge in their explosive episode titled Xenophobia, in Sickness and in Health. This documentary doesn't just scratch the surface of the tensions that define our communities, it goes right into the very heart of what it means to be human, to be vulnerable, and to survive in a country battling the demons of division, poverty, and fear. The cameras of Cutting Edge take us to the very spaces where xenophobia breathes life, where hospitals, clinics, and public service institutions become battlegrounds of discrimination. What we see is not just the ordinary story of migrants or foreigners trying to make a living in South Africa, it is the story of mothers, fathers, children, and sickly patients, often in their weakest moments, who face hostility not from the streets alone but sometimes from the very places where they should feel the safest. Imagine walking into a hospital in desperate need of help, your body weak, your spirit broken, your voice cracking as you beg for assistance, and instead of compassion, you are met with suspicion, rejection, or coldness. That is the raw truth Cutting Edge captures, and it forces us to ask ourselves, has our humanity been traded for politics, poverty, and misplaced anger? The documentary follows the lives of patients who have crossed borders in search of survival. Their stories reveal chilling encounters, being turned away from clinics because of an accent, being told to go back to your country even when lying in pain, being made to wait hours longer than others, sometimes even losing loved ones because help came too late. These are not isolated incidents, they are woven into the everyday experiences of many who live among us but carry passports from elsewhere. Cutting Edge paints the picture without exaggeration, because the testimonies themselves are too heavy to embellish. But here's the twist, the uncomfortable reality: not everyone in the medical profession is guilty of this behavior. In fact, the program also shows the bravery of doctors and nurses who defy the odds, who insist on seeing patients as human beings first, who refuse to let nationality dictate care. One nurse says on camera, "We are taught to save lives, not check passports." And yet, those who remain compassionate are sometimes judged or even threatened for standing on the side of humanity. This is the paradox: South Africa, a country with its own history of fighting against oppression, now struggling to deal with the anger of citizens who feel foreigners are taking too much, while migrants insist they too are simply surviving. Cutting Edge doesn't shy away from the emotions in the streets. It shows the interviews with South Africans who complain that hospitals are overcrowded, that medicine is running out, that there aren't enough beds, and that foreigners are putting unbearable pressure on a fragile healthcare system. Whether those claims are entirely true or just perceptions fueled by anger, the point remains that the frustration is real. People genuinely feel like resources are being stretched thin, and unfortunately, the easiest scapegoat becomes the migrant who is standing next to them in the queue. It is a conflict not of statistics, but of lived realities. Then there's the deeply personal side, the children. The documentary highlights heartbreaking stories of mothers giving birth under fear, not knowing if they'll be treated with dignity or hostility. Babies born into uncertainty, already carrying the weight of xenophobia before they can even speak. It raises a profound question: what kind of society are we building when even the first breath of a child is stained by prejudice? Cutting Edge confronts us with images that linger long after the credits roll, because they demand accountability not only from government but from each of us as citizens. The tension in the documentary is palpable because xenophobia doesn't exist in isolation. It connects to unemployment, crime, politics, and broken promises of service delivery. The anger of citizens is not born out of nothing, it comes from years of struggling in a system that feels rigged against the poor. But Cutting Edge forces viewers to think: is the answer to lash out at the sick, the desperate, and the vulnerable? Or is the real enemy national scrambling for scraps? There are moments in the program where patients speak about how they left their countries because of war, because of poverty, because of collapsed health systems back home. They did not cross the border with the intention to burden South Africa, but because survival pushed them here. Some of these stories mirror South Africa's own past, when many South Africans fled into exile and were welcomed by other African nations during the struggle against apartheid. Cutting Edge cleverly draws this parallel, asking the haunting question, have we forgotten too quickly how others once carried us in our darkest days? And yet, the documentary is not hopeless. It shows flashes of solidarity, ordinary people who stand up against xenophobia, South Africans who defend their foreign neighbors, and healthcare workers who risk criticism to uphold their oath to save lives. These moments are like flickers of light in a dark room, reminding us that not all humanity is lost, that compassion still breathes among us. Cutting Edge challenges us to nurture those sparks before the fire of hatred consumes us all. The biggest takeaway from xenophobia, in sickness and in health, is that this is not just a foreigner's problem. It is South Africa's problem. Every time a patient is denied care because of their nationality, we chip away at the moral foundation of our society. Every time prejudice creeps into hospitals, it weakens the very ideals of Ubuntu and justice that we claim to cherish. And every time we normalize discrimination, we set a dangerous precedent, because tomorrow, it might not be foreigners. Tomorrow it might be a tribe, a religion, a language group. Cutting Edge delivers not just a documentary but a mirror. A mirror that forces us to look at ourselves, to confront the uncomfortable truth about who we are becoming as a nation. It does not give easy answers, because there are none. But it does make one thing clear: until we address xenophobia with honesty, compassion, and accountability, the sickness will continue to eat away at both foreigners and citizens alike. So as the credits roll, the question remains with you, with me, with all of us: what kind of South Africa do we want to leave for the next generation? Will it be a land where sickness divides us, or one where health and humanity unite us? Cutting Edge has spoken, but the real answer will come from the streets, the clinics, the homes, and the hearts of ordinary South Africans. Now family, I want to hear your thoughts. Do you think the healthcare system is under pressure because of foreigners, or is that just a political excuse? Do you believe xenophobia is getting worse, or can South Africa still heal? Drop your comments below, don't forget to subscribe, and share this video to spark the conversations that matter most. The truth is uncomfortable, but it's a truth we cannot ignore.